legislation, that in fact women outlive men. That's a statistic, right, Dr. Missouri? And sorry, gentlemen, what can I tell you? But what we're trying to do was at the beginning to try to address this issue for long-term care with an investment and a beginning investment, the opportunity to be able to provide long-term care for seniors. That, in fact, is in the legislation. It's a beginning. It's not definitive. We couldn't go the full, just to try to do it all. But we are very, very much focused on that and very supportive of it.
And I suppose that you mentioned the Class Act. There's something called the Class Act. I can't remember what the CLASS means. I usually know, but I don't remember what this meant. That's an acronym, and it is a model for how we can go forward on long-term health care. But as you say, it is it's not only a health issue, it's an economic issue for all of America's families, not only for the seniors, but for their children and grandchildren as well. So thank you for what you do. But also, it's important, I didn't say anything about people with disabilities, and the Class Act is largely focused there. People with disabilities, and disabilities are everything. Diabetes, cancer, a diagnosis is a disability, a pre-existing condition, and it just goes well beyond any the mobility and the rest in terms of disabilities. And this bill is so important. That's why the other day in my office I had every kind of coalition that you could put together for people with disabilities coming in to say, we must get this bill passed now. Because again, no cap on what you receive and no cap in a year or in a lifetime. And I might say also we have mental health parity in there as well.
I would just like to add that, again, to tell you what we're up against, and I would say to my good friend Pat Dillon, remember, let's not make the perfect become the enemy of the good. But this struggle is deep and severe. There is a lot at stake here, and we have to make sure, we have to double down to make sure that we pass this. Now, our colleagues on the other side, they've had some pretty clear examples, as they point out in their bill, and Paul Ryan, a very good, constructive member of the Ways and Means Committee, who I disagree with, but at least he's laid out what their plan is, to voucher Medicare, to privatize Social Security, to block grant Medicaid, and to ultimately treat all health benefits given by employers as ordinary income. It should be an eye-opener, but instead, I think as Pat points out, everybody is concentrated on what's not in the bill, and the fear that's been generated around this bill is palpable. And so I think that's all the more important why we have to get this first step, get it done, move on, and then move forward and correct this on behalf of all Americans.
Over here, Melissa, go ahead.
Thank you guys for definitely speaking up, but I just wanted to share with everybody. 1.5 years ago, I was diagnosed with stage 4 lung cancer. I'm a non-smoker, and it had metastasized to my brain. They gave me 6 months to live, and it's been 2.5 years. So I started at a job. I started a job after college, and I was still at that job. It's not a job I wanted to stay at forever. But now, because of this, and I know I can't get coverage from another company, because of my pre-existing condition, I still have to stay at that same job with the fear that if I lose that job, I'm going to lose my health coverage. And my bills alone, without health coverage right now, are about $1 million a year. So not only do I have that worry constantly of fighting cancer, but I also have the worry that I might not be able to afford it someday. And that's exactly why this is so important to me.
laboratory with us. Melissa makes a very wise point, and sometimes you see this point made in the paper. Think of an economy where people did not have to be job locked, that they could follow their aspirations. They could become a photographer or a painter or a musician and be self-employed, or they could start a business, or they could change jobs, but they are job locked because they have a pre-existing condition. A child may be bipolar, there may have to be a diabetes diagnosis. The list goes on. It's what affects many, many people in our country. And we're competing with countries where this is not an issue. This is not an issue. So we have every compassionate reason, as Senator Kennedy said, this is about the character of our country, a right, not a privilege. But it's also, we can't afford the status quo because it's unaffordable to individuals, to businesses, to our budget, but it's also unaffordable to our economy in terms of the price we pay for curbing the aspirations of our people to do their very best because they are job locked. That does not honor the values and vows of our founders about the greatness of our country. So thank you, Melissa, for making that fine point as well.
I just want to say that just in terms of the specifics, so that you think we're just not talking here, that there will be funds provided immediately for support of a program to provide affordable coverage to uninsured Americans with pre-existing conditions. This will be enacted 90 days after the passage of the bill. Children, which is an immediate benefit to the some people will say, well, it's 10 years from now. No, it's now. We're going, right? No, Tony, let me just, the woman behind you had her hand up. Let me go to you there. Don't get back to you. Sorry, Tony.
I'm Planned Parenthood of Southern New England, and we serve 62,000 patients in the state of Connecticut. 90% of the people who come to us come for preventive care. And we are thrilled about healthcare reform and all of your hard work. You've talked a lot about equity, except for one service, and that is abortion care. And I'd like to hear from you how you imagine we are going to navigate through this so women don't lose benefits they already have. 2/3 of the patients who come to us for abortion care currently have insurance coverage. And the way it's going, it looks like that is going to go away. This week we've heard all over the news, STUPAC is bound and determined to have STUPAC language in this bill. Can you speak to the future of abortion coverage?
First of all, thank you for your leadership. One, federal funding of abortion is prohibited. That is the law, and this bill does not provide federal funding for abortion. Don't let anyone tell you anything different. Second of all, we will not have any diminishment of access. There will be an expansion, but there won't be a lessening of access. So if we agree that those two principles should be where we go with this bill, that's where we are. And if you further agree that we should have health care reform, then you shouldn't have any problem. But if in fact you want to hold up health care reform, you can make any representation you want. But the facts are, there is no federal funding of abortion in this bill, and there is no reduction or increase in access to abortion in this bill. We cannot have a bill with a STUPAC amendment in it. It's just not going to happen. Because that would violate that second principle.
Tony? State Representative.
We need your help so that we can follow in your footsteps in reaching the community and talking to the people. I am so tired of turning on the TV and hearing people say, this is what the American people want. I'm one of those people, and I want this health care, but we need your help in trying to get people to understand it is not an issue about changing what we've done. It's about pushing forward and making sure that we get it. So if you have posters out there that can help us in presenting it, if you've got facts and issues, we need you to help us do that, especially on a state level, because we hear it over and over again from the people on the other side saying, this is not what the American people want. This is not what the American people want. We need your help in trying to push this through. So whatever you can do for us to help us push this through, we would really appreciate it.
We are in favor of it.
I'm sorry.
What has happened, I mean, our organization and the members that are active in our organization were thrilled at the bill that was passed by the House. We were very happy with the pieces that helped preserve Medicare and expand the services for members. I'm from an organization where I don't think I have a member that doesn't have a pre-existing condition. The Alliance for Retired Americans, we all do, so we're extremely happy that that is being handled in the bill that is still there with you. We're hoping that you've had the courage so far to fight for a bill that was excellent for not only retirees, but all Americans. And we hope that you'll continue to have the courage, even though there is so much out there. And I'm most frustrated because it's my members, it's the elderly that have been targeted by what I see as a very well-financed and very well-orchestrated opposition that would like to see this be defeated. And they are becoming very much afraid of what is going to happen to their Medicare. I'm trying to tell them they should be afraid if you don't pass this bill, because this is what's the key to preserving the Medicare that they have been used to having. But it's just, we don't have, it's hard for us to get to all of our members. We don't have radio stations that will play us hour upon hour upon hour, or on a television station that will just simply try to diminish the job that you have done. And as John Larson said, go after you and after our president. So we're hoping, we know it's taken a lot of courage to go this far, and we're hoping that you will do whatever it takes to get this over the line. And we know that there's going to be a lot of opposition. We have to go to reconciliation, but if that's what we need to do, we need this bill. All of us, the retirees and everyone else, we need this bill.
Echoing Tony here, I guess I want to know what I can do and what I can ask the members of the New Haven Democratic Town Committee, and I see some fellow Democratic co-chairmen in the audience, Jerry Weiner. What can we do, this week, next week, and the coming weeks, so that the members of my town committee who are meeting and having conventions can get up and stand up behind health care? Thank you.
We have a young lady right
Hi, good afternoon. Thank you so much. It's really an honor for me to be here as a part of this. My name is Marie Rose, and I coordinate the Breast and Cervical Cancer Early Detection Program out of a community health center in Middletown. And just this past week, I had 2 women that were diagnosed with breast cancer. One of those women was screened through the program, 32 years old, from Africa, actually. And the other woman, I did not meet her until she was at a point of diagnosis, admitted to the hospital with invasive breast cancer that has spread so severely to her lung that it was partially collapsed, and she had trouble breathing. She actually went into a walk-in clinic to get services. She had not seen a physician in over 20 years. She did not know about the community health center. She did not know about the services provided to her. The only answer she could give me for that was, I don't have any money, I don't have any insurance, and it's too hard. Our program is only available, well, we do outreach, but the education is primarily available at those provider sites, those physician offices. So if there's no insurance, these women are not going to go. They're not going to get the coverage and basic screenings, mammography especially, that they need. My question following that is, we do provide services to women who are undocumented. And the Breast and Cervical Cancer Early Detection Program allows those women to be screened through the program. Our community health center welcomes those women. What consideration, if any, will be made in this reform to include those women to receive services and financial coverage for treatment.
Okay. I think it would be useful at this time to, Rosa, do you want to take another question?
I wanted to, I see one more hand, I just, can I, and if I may just say this with regard to cervical cancer, and that's a very, your issue is very taken, I'm not going to sugarcoat it. They will not. And let me just tell you, in passage of this bill, we would not be able to pass it. So that is reality. But I will just say this to you, on cervical cancer, takes, I think, and I've got so many medical people here today, I get a little concerned I'm going to say the wrong thing, that there are about 4,000 women who die every year from cervical cancer. We now have vaccine, we now have a way in which we can deal with prevention. One of the biggest issues is on the screening and being able to afford the screening. And so that people who again, we're not addressing the issue that you brought up, but the fact of the matter is that the bill would provide for the wherewithal in terms of screenings for cervical cancer. So we're going to, Emily, we're going to do this, make it the last.
I'm a gynecologist, having been in the trenches for about 26, 27 years. So I've dealt with all of these issues for a very long time. But my concern here is with this bill is without the public option, I'm sorry it did have to be said today, my concern is having dealt with the nightmare of medical insurance for my entire professional life. Once healthcare is mandated, I am really concerned that basically this is just going to be, the best day in the life of the medical insurance companies. And I want to know what you're going to do to make sure that without the public option, and I'm hoping the public option is still a possibility, that we can control the private insurance companies.
They don't like when I stand up. It's a signal. Because I can't contain myself sitting down on some of the challenges that you all so appropriately bring forth. First, let me just thank you all for what you do in the community to make America healthier. We're all in your debt from that. And we learn from you on it because you're on the front line. And maybe if I could just put what we're trying to do in perspective. Think of it this way. I say to my colleagues, the most privileged person in America, with all the wealth and opportunity and knowledge and access, will have better health care if the poorest person in America has access to health care. If we're all in a common record, and that's why the technology of the electronic medical records is so important. Teaching hospitals teach in places where they can learn from a wide array of diagnoses, and it benefits our entire healthcare system. Having access through the community health centers, which is a very important part of what we do. We have a large increase in funding in community health centers in the legislation because they have been the first line of defense in many cases for people to have access short of just going to an emergency room when they have absolutely no other recourse. So we're thinking not to think that this is a trickle-down thing, but to say the wave of the future comes from the people. Many more people treated, many more people healthier, much more prevention. As Dr. Missouri said, early intervention. So how we put this bill together was to say, how do we, again, I give it a AAA rating, how do we improve access, increase affordability for many more people, especially in the middle class who might not fall into some subsidies or whatever, and hold the insurance companies accountable. Left to their own devices, they have done great harm to the health of America. We thought, let me just put, today, what's today, the 6th of March? Yesterday was the 5th, March 5th of a year ago. Because yesterday I was making the speech in Boston, not this, but I was using these bookends. March 5th, 2009, President Barack Obama called a bipartisan meeting to the White House in the East Room. Democrats and Republicans, House and Senate. stakeholders from outside everybody, pharmaceutical industry, health insurance industry, community health centers, children's health experts, women's health, you name it, every possible manifestation of healthcare and public policy was present in the room. The president reached out and said, we want to work together in a bipartisan way to get this done. Senator Grassley stood up, the Republican ranking member from Iowa, and he said, he questioned the public option. President Obama said, public option, in my view, is the best way to hold the insurance companies accountable, to increase competition, and make it better for the consumer. If you have another way of doing it, put it on the table. The American people know what the doctor told us. If you're mandated to have health care, don't throw me to the wolves of the insurance companies. Give me some other option. Well, as you know, the insurance company weighed in, and you know it locally, weighed in on this in a way that prevented 60 votes in the Senate from getting the public option. But we were determined that we would get as much as we could that a public option could achieve, because it wasn't about the ideology of that particular tool. It was about what it would achieve for affordability, access, and holding the insurance companies accountable. We went to an idea that has been espoused by Republicans, the exchange. Olympia Snowe was one of the co-sponsors of, co-authors of legislation. Senator Enzi, or the ranking Republican on the Health Committee, that is one of the committees that wrote this bill in the Senate, espoused that. So for 1 year, now we had the bookend last week, on that last Thursday, when the president again called Democrats and Republicans together to talk about any ideas they might have to improve the legislation as it went forward. So let's dispel one of these things, that this has not been open to ideas. For the year in between, far too long in my view, the Republicans have had their chance, or those who oppose health care have had their chance to put their ideas on the table on how they would serve the American people. What we saw then was that there weren't many ideas, but the president was still open and receptive, much more patient than some of us on that score, to some ideas they had about improving the exchanges or removing more waste, fraud, and abuse, and dealing with some issues. Actually, one good idea emerged. One good idea emerged from there. And something we had been fighting for, but it helped us, which was to make Medicaid docs, to have primary care docs for Medicaid be paid the same as Medicare doctors. We have been fighting for that, but again, in the competition for the dollar, there's decisions that were made that said we may have to wait for later for that, but now we will have some of that. And we had some, and now we have a little more. Maybe my whole point is, there's enough already with waiting for another view of the world. You are either for, and I think what emerged from last week's meeting was, you are either for regulating the insurance companies or you are not. And you either are for eliminating the denial of coverage on the basis of pre-existing conditions, and you are not. That's the most obvious manifestation of reforming the insurance industry. So here we are, being for 1 year, trying to find bipartisanship and being criticized that the bill is not bipartisan enough. For 1 year, having other people characterize a bill because there isn't a final bill, and there will be in a matter of days or hours, that people could call it anything they want. It has this, it has that. I mean, it's unbelievable, the mythology that exists about what this is. But what it is a bill about innovation, prevention, wellness, a healthier America, affordability, access for the middle class, accessibility for tens of millions more Americans. It's a job creator, 4 million jobs, this bill alone, not counting all the jobs that John has in the health IT and the rest of it. So when you ask, what can you do to help and how can we dispel much of what is out there? when you do something like this, I mean, we all fought very hard for the public option. We kept it alive as long as we could. Then when it came down to 51 votes, we thought our prospects are even better now. But that is not the case. Under the up or down vote, should I go into the majority rule, the constitutional majority, and the reverence, the enshrinement that we have for majority rule in our country? Do these senators want to have to be elected by 60% of the vote?
Yeah.
So again, they fear-mongering.